groundwork to get going. So this is the XPRIZE Pandemic and Health Alliance Jam session. We're doing it this time in conjunction with NextMed Health. NextMed Health will describe it a bit more, something I'd share along with Shauna Butler and others to look at the future of healthcare. So it's very relevant for this conversation. The XPRIZE Pandemic Alliance, as many of you know, but some might be new to this, is been around since early in the pandemic. The goal was to address the challenges of the pandemic, but as we did that, though the pandemic is not gone, we've evolved to address general healthcare realms as well. And these joint action meetings bring together folks from inside the Pandemic and Health Alliance and beyond to act collaboratively, spark off each other, be a bit of a riff in ideation sessions, and then hopefully many of the things that come out of this move forward. And a bit of the rules, as we'll talk about later, is jump in, be mindful of time, leverage the chat, and make cross connections that you can take forward after the jam as well. And our idea here is to kind of think about what's coming next in healthcare in the next year or so. There's obviously, we're still in the sick care, intermittent reactive side of health and medicine. We want to move to a much more proactive and equitable one. The focus of the Alliance, as I mentioned, has evolved, started as focusing on the pandemic, prevention, diagnostics, PPE, and beyond. We're now moved to the Health and Pandemic Alliance. We're supported by over 100 different members from NGOs and Fortune 50s to small startups to academics. We've ran several prizes and challenges. The largest scale one was a $6 million rapid COVID testing XPRIZE we did with Jeff Huber and others from the Open COVID Network, which was the fastest XPRIZE ever run in the setting of needing fast, frequent, cheap, and easy COVID testing. And that prize led to 9 pretty amazing winners, several on the market. Our Health and Pandemic Alliance has a pretty incredible brain trust, some of whom are joining the call today, ranging from all the folks here. I won't do call outs, but a really amazing brain trust that's been helping us guide the XPRIZE Pandemic and now Health Alliance. We recently had a science conclave with our Visioneering Brain Trust, looking at future brain XPRIZes. And I won't read this whole mission statement, but kind of as we think about 2023, it's useful to have like your key, as Peter calls it, transformative, what's the word, like mission statement. And so this is what we came up with for review for 20 years from now, right? Imagine a world where everyone has access to care, where it's equitable, where it's optimized, where it's crowdsourced. And while that might be a 20-year view, some of this can come into our 2023 thinking. We came up with a pretty incredible new XPRIZE models, including vaccines for all, to think about being able to make vaccines on demand almost anywhere in the world in the size of a large truck. Another concept around surgery for all, which is a big dearth of need for surgical access to billions of individuals. Another prize was a CareBot, enabling care at home, which is a big challenge, especially with the aging population. And one where we're kind of making the ICU pod, taking what you see on the left to the right. So that's some visions, what we have looking forward into some potential future XPRIZes. We do anticipate in 2023 there will be a XPRIZE, the HealthSpan XPRIZE, which looks to be a $100 million plus XPRIZE, looking at ways to incentivize teams to really move the needle on extending healthy health spans. So watch that space. Hopefully that's going to be announced in 2023. Briefly connected to this, because many folks from the XPRIZE world are connected to the NextMed Health world. This is a program that's evolved from the exponential medicine program I ran for a decade. We're launching that. It'll be in March, and we'll have XPRIZE there as a partner. It's kind of the idea of connecting all the dots as we are here, from ideas to ideation, from small partners to startup labs and the innovation lab. We have some pretty amazing faculty, ranging from Lee Hood, kind of the father of precision wellness and medicine, to Paul Stamets on psychedelics, to our own Anusha Ansari as we're looking about pricing innovation. So with that, I thought I'd start with my own sort of first ideas about what's coming next, and then I'm going to hand it off to many of you. I think all of us have become really good artists, some of us in the last month with a little bit of help from DALL-E. If you haven't tried DALL-E, I think this whole idea of generative AI is obviously moving very, very quickly, GPT-3, and probably next year we'll have GPT-4, and someone on the call can better explain how that works. I think maybe one of the best applications will be for it to come up with new names for mispronounceable drugs. Here's one, Adiatulev. But what's pretty amazing about this, I even just chatted, put this in literally 10 minutes ago, asked GPT chat, what will happen in healthcare in 2023? And it came up with a relatively okay answer. It can also write poems, but it says healthcare is likely to evolve. It'll have more AI, virtual reality, telemedicine, more focus on preventative care. Healthcare systems will continue to face challenges. Yeah, so some pretty true statements. If you haven't tried GPT chat, it's pretty magical. And I think it's an example of this convergence of healthcare. When we think about 2023 and beyond, it's not about any one technology or bucket. It's how we put them together, how they're often becoming more digitized. These are the 5 or 6 Ds from Peter Diamandis. Many technologies are becoming digitized. That means it's disruptive to the old industries. They're dematerialized, can sometimes be free and democratized. And that's happening with GPT-3 and those elements as well. And so as a reminder, when I think to 2023 or beyond, we have to remember the power of exponentials. Where are we? How quickly things move, as we've seen with AI and robotics and 3D printing and BCI and COVID, how COVID catalyzed a lot of elements in healthcare, telemedicine, mRNA vaccines, which are now, as of last week, just being published as ways to converge as personalized cancer vaccines. Quite exciting there. Another element I think is going to be more important in 2023 is taking all these new forms of data and making sense of them. So data to actionable information and narrowing that gap to where it's useful at the bedside or the website. And that's going to converge into a bit of this form of precision wellness. That's, I think, going to get more into the zeitgeist, using all these new forms of data to optimize health span, right? Not just the sick care side of the equation. And so if I was to make a prediction for 2023, I think we'll get to this idea not just of generative AI or GPT chat or GPT for darling, but think about this idea of a digital twin meets GPT, generative health or generative, call it generative health, where you'll be able in real time kind of leverage your personal health avatar, your sort of digital twin that's emerging, and provide you what you need in terms of the environment, maybe your diet, maybe the virtual coach that you need that's going to match you. So that's my little take. I think generative healthcare will start to emerge, leveraging all this. So I will stop there and start to hand it around the room. Again, the jam is short and brief. I'll call on folks at the beginning, but raise your hands, use the chat, and let's explore what's coming next. It's going to be an exciting year. There's that famous quote from Bill Gates, though, that people tend to overestimate what might happen in a year and underestimate what can happen in a decade. So we can certainly talk about what's going to happen, hopefully, in this decade, this health age ahead. So with that preamble, I am going to see who I want to call on first. I think from our Brain Trust, our XPRIZE Pandemic Alliance Brain Trust, Sarah Lynn Mark, who's a physician extraordinaire involved in space medicine and femtech and beyond. I'm going to hand it over to you for your predictions for 2023.
Great. Thank you so much, Daniel. Hi, everyone. I'm talking to you from Washington, D.C. I also want to thank the XPRIZE and the Trust for hosting our iGiant Roundtable this spring. It was really phenomenal. So if you guys know me, you know I tend to see my world through the universe of space using a sex-gender lens. And I know a lot of us are familiar with what I'm talking about, but just keep in mind that the Cambridge Dictionary said this is the year of the woman. And it really define women differently than what most people are used to, and really taking that non-binary gender spectrum approach. So if I were to look at 2023, I think, Daniel, we're actually going to move beyond femtech, actually looking at innovation. And I just heard today that the NIH is partnering with the Gates Foundation, you just mentioned Bill Gates, to have an innovation equity forum this summer and in Senegal in October. So my predictions is that we're going to move along the space of precision innovation, gender design across every single aspect, not only taking precision medicine to what is the dose for people, but taking it down to how does your sex and gender impact? You know, you talk about PPE, actually designing masks and PPE that meet the needs of individuals. So looking at anthropometry functions. So we know men are not little big women, women are not little men, and that we have the gender spectrum. So that's my view. Precision innovation, gendered design will be leading the forefront as we go into 2023 and beyond.
Thanks. And there's just some resources that already, you've been doing some work there. What would you point people to?
Yeah, absolutely. Thanks. Yeah. So tomorrow, by the way, if you're interested in the impact of sex and gender and how the body adapts in space, we're going to be hosting through iGiant, my nonprofit, which is an acronym for Impact of Gender and Sex on Innovation, Novel Technologies. It's the only nonprofit accelerator across health, IT, transportation, retail sectors in the world. Our students across the globe are hosting this roundtable at 11 o'clock Eastern time. Reach out to me through iGiant, IGIANT, and I'll give you the Zoom info. Also, one quick thing, I recently joined Star Harbor. It's the first publicly accessible spaceflight training and R&D facility in the world, truly democratizing space travel. If any of you are interested to join some of our committees and councils, please reach out to me. We're creating, standing up a medical advisory council, scientific advisory board, a strategic outreach committee, and we're really trying to weave in a lot of what I know many of you are doing, and we want to take it not just on Earth, but bring it up to space. So thanks, Daniel, for giving me the minute.
Sure. Speaking of space, my background is actually an image from Apollo 17 that was 50 years ago this month. As a wee child, I was actually at the launch. And when I was a medical student, I met Gene Cernan, the last man on the moon. And obviously, we just saw Artemis happen, and we may be unlocking more space, and maybe to the moon with Artemis with humans in not 2023, but 2024-ish. What would you see as some predictions of the spin-offs that health and medical innovations have had and will have in the next few years that come down to Earth as well?
Yeah, so just quickly, we're always talking about that tech transfer. What we use in space is going to have relevance on Earth. I think it's actually going to be what we use on Earth is going to have relevance in space. So right now we're moving into that world because commercial space travel is going to allow all of us to go up. You don't have to be that perfect specimen. So just keep that in mind. I mean, Daniel, I would need like 2 hours on this because every single system in the body adapts. As you talked about telemedicine, actually it was the space program that pioneered telemedicine. We had our first telemetry of, you can imagine, sinus tachycardia of Neil Armstrong when he landed on the moon, completely appropriate. So I think, imaging, I think actually also having virtual reality to be more of that doctor in the box will be certainly important. I know XPRIZE has been looking at, immediate sensors, really utilizing smart technology. Radiation is a significant issue. It's an issue here on Earth, especially as we put our patients through so many imaging devices, but having better radiation protection, not only from the devices that we can wear and the shielding in a vehicle, but maybe even nutraceuticals. So there are so many different exciting areas. And, it's just really, like I said, I see the world through the universe of space using this lens, but every one of us can do that. And once we do that, the universe is the possibility.
100%. And space and exploration pushes innovation, which often starts off with a black box, for example, I worked on to track astronauts on space station, now, helped evolve to wearables. And now, 20 years later, we're all wearing some sort of tracking device, if we want to call it that can help not just measure our health. And one thing I think will shift in the next decade and year is that we're going to start to connect the dots, not just from our Fitbit data and our Internet of Things, but start to understand our baseline. There's the Verily Baseline Project. There's the NIH All of Us, which is starting to release this genetic information. So we'll have more inference of what this information means for us, and our clinicians will start to use it going downstream. So from outer space to inner space, I'm going to call on Tori Smith, who is going to give some predictions. I know he's working on an inner space technology. Maybe we'll see where that's going to be in 2033. Tori, quick share.
Thanks for that. Yeah, basically, I'm very hard into telemedicine, and we're basically just adding propulsion to the world of passive pill cameras. The goal is to basically allow people to do an upper endoscopy over a Zoom call and let our little robot swim around inside your stomach. I would love to send these up on a space flight one of these days, because space medicine is kind of like the ultimate telemedicine. And with that, thanks, everyone.
Well, can you show us, do you have one of your little elements there? And just synthesize it in 30 seconds. What is this able to do, and what's the reason?
Pillbot is basically a little swimming robot pill. We have 3 motors that squirt water in 6 different directions. And so we can move an X, Y, and Z in the human stomach if you are willing to drink a bunch of water. We swallowed a bunch of these ourselves and just partnered with Mayo Clinic. Super excited about that. But it's basically an entry-level upper endoscopy over a Zoom call.
Right. So care anywhere from the moon to Mars to your insides. Awesome. I am going to raise your hands. I'm going to call on my partner in crime, Shauna Butler, who's on our XPRIZE vision board for new prizes. Also my partner in crime on NextMed Health. Maybe for your vision, Shauna, what's now, near, and next, and also what's needed for 2023?
The arts. I really think from the standpoint of where we are at this moment in time as human beings and as communities, the arts have this incredible power to change our brains, our bodies, our behavior. And what I love about Dolly and people playing with that is that they really are tapping into a lot of this creativity, I've been paying attention to Johns Hopkins. They have an international International Arts and Minds Lab, and they are bringing together globally this group of scientists, institutions, community organizations, really thinking about the science, the evidence behind how arts change us and improve. They can manage stress, they can help recover from trauma. They help us to be more creative, more kind, more connected to our communities. And I really see that this is a place that we're leaning into. So my prediction is that when we're given more tools and digital, with the digital tools, we're seeing more and more categories of arts. We're seeing more and more people being able to express themselves. So that is my prediction, is that the arts are going to have a far more powerful impact and embrace in how we're going to improve our health and our well-being and our communities and connections. And so keep baking the sourdough bread, sharing your creativity on charcuterie, collage, paint, and use Dolly. So that's really my prediction, is that art is going to play a much bigger role in our health and well-being.
Thanks, Shauna. Can you synthesize a bit about how art is already playing a role, or some of the benefits or data or outcomes from art in health?
Yeah, actually, we just did an episode looking at all of this, and we're seeing people join choruses. There's actually a whole organization called National Medical Orchestras. So these are orchestras made up of their musicians that are also healthcare practitioners. When we bring it to patients, what we see is it can reduce blood pressure. It can help to manage trauma and anxiety. When we take it into schools, kids are able to better not hold on to a lot of their stress and their frustration and anger. So we're seeing it in the younger generations. I think there's a beautiful exhibit that's going around the country that was done using digital artists, artists who were creating their works digitally, doing images of healthcare workers who died during COVID as a result of being practicing and treating people in COVID. And they put it together in a house that's it was up actually on the national in DC against all of the different war memorials. And people came in and they felt, when people die, it actually brings community together, but it's a space of grieving. But it was meaningful for the families. It was meaningful for their friends. So we're seeing lots of different ways, whether it's poetry, whether it's orchestras, whether it's choirs, whether it's visual arts, and also aesthetics. So there's the arts, there's the practice of doing something, but then there's also being exposed to things in nature or to beautiful stained glass, hearing things. So it's not only being the creator, but it's also being the beholder and seeing how that changes our neurochemistry, seeing how the hormones that it releases. So all sorts of benefits to brain, body, and behavior.
Right. And we know that health is social, and being together is health has its health benefits. We can't use augmented.
Having meals together is a form. Yeah. So that's my prediction. I think that we're going to be using a lot more of that.
And our friend, the neuroscientist Adam Gazzaley, has done a lot of work on how the brain responds to music, and that crosses all species. I just had a comment from John Vitale at Brain Music Labs. Maybe you want to comment a bit on what you see next in the brain and music and how it impacts our mind and body.
Hi, everyone. Nice to be here. I love these sessions. So I've been lucky enough to work with some of the neuroscience teams that are developing telemed mental health apps. And through designing special entrainment music, we found ways to physiologically reduce the heart rate, the breath rate, and increase HRV. And we're getting the biometrics and tests. We did a big 3,000 tests with Boeing's HR department, and rated 1 to 5, we can get people
right there. I'll try. Yeah, keep going.
They can people self-rated on a test scale 1 to 5 how well this music reduced their stress levels and got them in better states for whatever they need to do next, and we got tremendous results. So I'm finally wrapping that up into a narrative, and what we're finding is that just like you said, Daniel, the personalization factor of onboarding using AI and integrating a couple systems means that you might have a coach that can kind of look at where your baseline is and say, hey, you're this type of person, you need this kind of energy of music to meditate better than you need this and this and this, and do granular prescriptions about how music and sound therapy can be a stratifying supporting structure for all these other initiatives. And the beautiful thing is it's really easy to digitally disseminate. So I'm making streams and custom apps and prototypes that these wellness companies don't have to go to a Calm and Headspace and go through a whole email funnel, but could actually get the code right into their own systems easily and quickly.
John,
I think you were involved in the past with Focus at Will, which I use, and I can imagine having a Focus at Will that's really tuned to your brain and creates that music on the fly, kind of that generative AI.
Exactly. Yeah. So this is, looking at the data from Focus at Will. Focus at Will, we were in peak performance and how do you, cut distractions. And what we really found is that personalization was a key factor, and understanding energetically where you are on the spectrum will help us really prescribe that. And now with AI generated music, that was one of the barriers eventually. Before it was like, now I got the recipe books, but how do we make all the music where people would understand that they don't want everything on Spotify? That's more for entertainment. This is more functional music. And now I think I have new tools coming through, and I think you're going to see some very specified, specific music services that can use great recipe books and then help with AI for heavy lifting to build wonderful libraries to support many different initiatives.
John, on that, we're seeing such a rise of antisocial behavior in our healthcare settings, particularly in, a lot of the psych units. And there have been groups where they've been using this music to help calm, to help de-escalate, to help support people in, a very troubled time. But they're finding that actually reduces violence on, and aggressive behavior and antisocial behavior on a lot of these in places where they're providing mental health services. Same thing in nursing homes, to help manage anxiety and tension and to bring people to feel like it's familiar, to take them to a place and a time machine so that they don't feel as stressed by their locate or the unfamiliarity of the location. So we're seeing lots and lots of wonderful applications and outcomes.
So prediction, 2023 will start to be the year of better social connection, using music, not as just therapy, but for brain states, meeting our vagus nerve. Voice, which is tied to all this as well, is becoming a incredible biomarker. This idea of acoustic epidemiology. We'll have Peter Small from HIFE at NextMed talking a bit about that. The sound of your cough can predict whether it's TB or COVID. That's going to become more mainstream. So part of what might happen in 2023 is we're going to get away from wearables and otherables, but our voice and our faces and our sound environment will and our hearing will play a role. Let's hand it over to Reza, one of our Visioneering Brain Trust members out of the Great White North in Canada. Reza.
Thank you, Daniel. We actually just had our first proper snowfall, and it's looking really lovely out here. Really, to echo Shauna and John's point, I think it's not just that we're going to be more social. I think we actually need to learn social belonging again. Definitely, I think a lot of the teenagers, a lot of the kids that went through COVID, some of what they learned was really not great. I'm quite confident that the technology we have right now is not going to be the solution. We need either not to use any technology. I think there's actually some value here where we do need to love one another more than we love technology for a little bit. I think that there should be a little bit of a pullback from this stuff. And the chatbot AI, actually, I was just playing with it just before coming on this. It's amazing, but it also has this impact of making you feel really crappy. Like when a chatbot can write something much faster and better than you, really, how good are you? Like, how worthy a human being are you? So, the ways we look at ourselves and then we look at each other has to really change to accommodate the crazy technology that we're facing. And I think that's sort of one wing of it. I think the other part that we really learned out of the whole exchange during the pandemic was that we could actually do a lot of things extremely well remotely. I think I probably had more remote conversations and remote collaborations in the first month of the pandemic than I'd had in all my adult life before. So I think that is gonna have to be part of our new reality, that we can find talent anywhere in the world, and that includes healthcare talent, maybe medical diagnoses, or additional conversations with patients, with physicians, with clinicians of all sorts of professionals, and perhaps creating better markets or better ways of connecting those people remotely so that they could kind of connect into the decision point. But at the same time, like I said, not just getting too dependent on technology to bring us together. Actually remember that we have to do some stuff. There's a comfort that needs to happen when people get together, and some of it was very well practiced before the pandemic, and we need to figure out what that was and get back to it a little bit.
Right. Put down the cell phone and hug more. It might be a theme for 2023
Well,
safely.
maybe not hug, because there's still something flying around, but still, yeah.
After using your
Something
fast,
like
frequent, quick and easy COVID and other testing, which is evolving.
Exactly.
And one way that GPT chat, which can even write, medical diagnoses if you put in elements, or I saw a great example of a doctor. We often spend too much time writing the insurance company saying why your patient really needs the test. It would write the whole reason why this patient needs a cardiac echo and why it should be approved with references. So hopefully in that way, particularly with the burnout issues amongst clinicians, some of these tools will help us, deburden us from some of the integration with having to chart things or listening to voice and writing the physical exam note, for example, and we'll give more time for that social connection, which is so critical part of the human and patient clinician experience. Any technologies you're working on specifically for 2023 you want to share?
Yeah, we're starting to work on pediatric imaging. So this is an area of great need. Children between the age of 1 and I think it's about 5, they tend to need anesthesia in order to be scanned, and this causes a huge backlog for imaging. So one of the stuff that we've been working on is how do we make the MRI space really comfortable and potentially even gamify it, so as to remove some of the really hostile elements to it. That the MRI is very constrained, it's very loud. Maybe there's ways where we can kind of keep the MRI running at all times and adapt it as the child enters. Maybe the child doesn't need to be lying on a bed, which is a fairly unnatural thing for a child to do. Anybody who's had to sleep with a child in their bed knows that really well. That there may be ways that we can kind of gamify and use different kinds of setups to do that. So that's one of our focus for the coming year.
Stanford Packard Children's Hospital has done a project using Oculus Rifts and stuff for kids. Before they go into the hospital for a procedure, they can sort of see the environment, or some people are using it in dentist chairs, for example, or others, to put yourself in a calmer environment virtually. And I think 2023 may be the breakout year for augmented and virtual reality. The rumor is that the Apple augmented reality glasses may come to market. That's going to have a ton of applications in healthcare and beyond. And the next generation, the metaverse, whether we want to call it the metaverse, whether it's in an MRI machine or otherwise, will, despite all the potential downsides and challenges of the entire spectrum, have a lot of interesting applications. And so watch the meta space. I'm going to call on Lee Stein, another one of our Pandemic and Health Alliance Brain Trust members. Lee, you're up to always some pretty amazing work. What do you see for 2023? Hopefully he's still there. All right, go ahead.
First thing, I want to put up a slide. There's 2 different places, and can you see future is self-help? Did that show up?
Sure can.
Daniel, did this slide show up?
Yep, it's loud and clear.
Okay, so basically, the way we've been looking at the healthcare, this is something everybody on this call knows, but making it graphic makes it a little bit easier. The medical system as we know it, and I've been a patient very actively in the past couple of weeks. I could have used that endoscopy camera last week when I had mine. But basically, you can't really enter the healthcare system unless you have a symptom. And that leads to a billing code, which leads to a testing code, which leads to a diagnostic code, which leads to prescription or treatment, at which point you go binary. You either go chronic or you return to a pre-symptomatic role. Everything, Daniel, with the things that you show and with all the devices is moving into a digital longitudinal role. And there's really no place for it in healthcare as we know it today, where you start out healthy, we get longitudinal data, we do some predictive analytics, we create a recommendation engine to make sure that we stay healthy and never enter the right side of the chart. So I think that all the things that you've been showing, Daniel, with all the devices will move us to that left side of that chart really easily, and we'll become a predictive society, because that's where we'll get the democratization. We're also look at the fact that I think Peter likes to say, if you want to make $1 billion, go help 1 billion people. But sort of there's very little way to access healthcare for person 3 billion in 1 to 7 billion. So, and that's more than 1 billion people. That's 4 billion. But so the real question is starting to get those digital tools that you keep showing, but getting them into a way that they are a practice of predictive. Now, for 2023, the thing that I'm looking at being the most unique step, you had mentioned a few minutes ago the vagus nerve when you're talking about the music. There was some work that we're seeing that DARPA is doing and that NIH is doing through BARDA and BARDA++. We're basically seeing devices that can start to measure vagus nerve signal. And I think that this will be the year that instead of just recognizing vagus nerve and anecdotally talking about how we want to calm it down and some of the oils and some of the procedures, we actually have some technology at our fingertips that we'll be spending a lot of time with this year of basically measuring the actual signal from that vagus nerve. And I sort of look at it from the standpoint that there's a lot of vagus conversation, but not a lot of vagus measurement. There's a lot of vagus talking about putting tone into the vagus nerve, but not necessarily to be able to measure it. And I think actually what it's going to be measuring is actually the state of inflammation. You know, that gets to the question, is inflammation a disease? And every disease a symptom of different types of inflammation. And so I think we're going to start to look at inflammation differently once we're able to measure inflammation digitally. And that's what I find really exciting.
Fantastically. Are there any, I mean, you can interact with your vagus nerve through breath and mindfulness, right? That's one
Yes,
tie.
yes.
You get some other examples of how the vagus nerve is being tied, everything from the microbiome, which you've worked on, to, you know, the brain.
Okay, well, for those who are not familiar with vagus nerve, the real quick summary is it's the longest nerve of the human body. It is the only nerve that hardwires the colon to the brain. It is hardwired point-to-point wiring, but it just happens to run past every organ of the human body and has tentacles that reach into it. So that we often talk about the central nerves inside the spine, you know, inside the spinal cord being so critical, but those central nerves are basically moving movement data, you know, information for motion and so forth, where the vagus nerve is really working with your parasympathetic nervous system. So it's a complete, I think that I'm the least medically trained of everybody on this call, but so discount everything I'm saying, but it is essential for our well-being. I think I really do wonder whether, you know, that vagus nerve is really sending a signal like twisted pair telephone or fiber optic, since it's running from the colon through all those organs and picking up all that data. I think at some point we will be able to decode the electrical signals inside the vagus nerve. Right now, people are putting tone in through this portion of the ear where it comes closest to the surface, and the breathing. But I don't know whether that answered your question, but it just gave a little bit more color on why measuring inflammation, the vagus nerve will be the thing that helps us digitize and read the signal of inflammation. I don't know whether anybody disagrees with that, but I'd love to hear more.
I'll let other folks chime in, but I'll just make a point that tied to this is sort of this new realm, which will emerge more in 2023 and beyond, of electricity as medicine. Companies like Kala Health out of Stanford Biodesign using a wearable and electricity to interact with your nerves and knock out tremor, for example, or others that can interact with your vagus nerve through neurostimulation and potentially play a role in everything from mental health to GI health, or, you know, pacemakers that go beyond those for the heart and for the.
And Kala's doing some very nice work in, I guess, in Texas. The one thing I wanted to do as a final thing is just to give a shout out. You had mentioned Jeff Huber early on. He's CEO of Grail. I did a Grail test this year. I went through a fairly significant amount of medical testing. And I would tell you that the Grail test for 50 different cancers from a blood test, the user experience was spectacular. The customer experience was spectacular. And quite frankly, getting those results and knowing that, you just ruled out a whole bunch of things just because of one simple blood test. The peace of mind that came from that was spectacular, but the customer service and the user interface with everything he's built was just fantastic. So I suggest everybody go out, and it's a little expensive. It was $900+ to get a blood test, but it was better than the other 30 tests that I got through the healthcare system.
It's still cheaper than a colonoscopy and also getting a malignancy. And it's been pretty amazing to see that sort of rise, companies like Grail and Guardant and others emerging. We actually almost did an XPRIZE for early and easy and inexpensive COVID cancer screening, early detection. It's still not, as you said, as democratizably cheap for the rest of the world, but it's going to get there. And I really want to tie back to your earlier comments at the beginning on continuous monitoring. I'm going to cold call on Stacy Chang in a second, because it ties into how we design our healthcare. It's still very much based on intermittent data from your annual checkup. And now we have our continuous data feeds, whether it's from our wearable or soon from our swallowed pill. And the question might be, how do we integrate and engage with that to understand, Lee's data versus Daniel's might be quite different. It's when it changes, when it gets interesting. If some of you have a wearable, maybe part of your 2023 mission is to start looking at your continuous data, what's your resting heart rate been, your min and max, your VO2 max can be calculated. Even start to share that with your clinician during your annual exam, and that'll start help catalyzing this, because the challenge often is the workflow and the incentives, which aren't built for continuous data and information. And maybe Stacy, if you're able to talk, you've been a real leader in designing healthcare. How do you see some of the challenges and opportunities the next year or two ahead to integrate some of the tech with the potential to move the needle, and also integrate it into the clinical side of the equation?
Hey there. Thanks for calling me out. Yeah, no, there's actually the thing I was going to say that I'm seeing a lot of is using under-resourced venues and settings to prove out some of those technologies. Some that are actually really familiar to us already, right? But adapting them to the needs of under-resourced settings, whether that's rural here domestically or in the global South, and how we reimagine how some of those technologies prove useful in ways that are actually not even that compelling anymore for us in the developed world or in well-resourced settings, but are game-changing for individuals elsewhere. There's a really interesting dynamic that I'm seeing in these dual market strategies, where the expertise and the capacity to interpret some of the diagnostics is still actually retained in the sort of high capability venues that the likes of us sort of sit in, but the skills necessary to do the procedures or the diagnosis or just to run the equipment is about upskilling individuals in under-resourced settings. And so I'm seeing that really interesting, because traditional market models have both of those in the same place, and in under-resourced settings that the intellectual capability often doesn't exist until it's been developed. And so borrowing that from underutilized capacity in the developed world until the developing markets are in a place to do that on their own. So that's a pretty big trend I'm seeing, one that maybe we can help perpetuate as well.
Yeah, that sort of ability to shift and democratize, whether it's diagnostics or therapy. One good example is a company based in Kenya is now taking some of these pretty low-cost diagnostic devices, the butterfly ultrasound device, the AliveCore for doing EKGs, some point-of-care lab tests, and building out almost like the One Medical for Africa. And they can leapfrog a lot of the regulatory and lobbies that would normally exist here, and bring 80% of what we can do in almost any tertiary care center to a pretty remote clinic. And then it makes sense of that data and call in the help when they need it remotely as well.
Yeah, I mean, and it's interesting, some really basic stuff, just like basic data compression allows, workers in the field who are relatively unskilled to just use an ultrasound and move it between landmarks on a torso, right? And then capture that data, compress it, and then send it off in low bandwidth scenarios for someone else later to actually do the read and the diagnosis. So there's some interesting, promising sort of opportunities in that front.
Yeah, the theme of upskilling, so anyone can be an ultrasonographer. There's even one for babies born to screen their hearts, puts the ultrasound on, does all the movement itself, and sends the information to the cloud or to the local pediatrician, which obviously early detection, early prevention plays a huge role in saving lives. Anything about on the more US centric side, now with all this explosion of data, no clinician wants more data from their patient. You want the insights, and how do you integrate that into workflow and the incentive models, which are often broken?
Yeah, so it's interesting. I won't go into sort of the history and certainly my the experience I've been having in the last couple of years, but I mean, I think at this point we can't ask any more of our medical practitioners in terms of interpreting and consuming data. I think we have to do that on their behalf, either through AI and some of the things we've talked about, but also utilizing the person who actually cares the most about their health, which is the individual themselves, right? And a lot of that is really about, you know, from in the most basic version, human-centered design, which is the thing that I've been spending a lot of time on over my career. But actually engaging people in the thing that they actually already want to be engaged in, but in a way that they can actually respond to it, right? So a lot of you see all of these on YouTube or wherever you watch your media now, where the glucose monitors that help interpret, you know, what you're eating. I was on YouTube, I think this morning, there's this ad where the guy eats a Chipotle burrito and then watches the response on his individual glucose monitor. I mean, that's real. I used to eat a lot of Chipotle burritos, not anymore. But like in the post burrito coma that you could never understand is actually of interest, right, to the individual and the way they sort of titrate their own intake, but is now giving us space for the individual to start interpreting them on behalf of the providers who actually have the knowledge to do something about it. So that I think is a really interesting shift as well.
Well, TikTok videos soon with your real-time blood sugar will be part of this. That does raise the point, I think. I overbanding strong, but maybe 2023 will be the year where this really connects, is this crowdsourcing of data. People are now opting in to share on videos and otherwise their lab data, their personal experience. There's a startup out of Israel called StuffThatWorks.health where you can share what your symptoms have been with long COVID or psoriasis or diabetes or cancer and learn from others. So I think, and particularly now that the sensors are more available, there'll be an ability to make bigger meaning from that, whether it's the All of Us trial, the baseline trial from Verily, or the crowdsourced stuff that works, and gamifying that a bit, and using the design elements to keep folks contributing and not just feel like they're getting their data sucked from them from cookies that they haven't understood.
Yeah, I think it's a win-win, right? A win-win-win maybe, because providers don't have the bandwidth or sometimes even the capability to interpret all of that, and getting the individual to do some of that interpretation while also upping their own engagement with their own health and taking on more accountability only benefits us all.
100%. Anyone want to jump in with comments, questions, anything we've already covered? I'm going to call on Rahul next, but we've had a lot going on. Does anyone want to jump in with something? Rahul is in India, so he's on.
Yeah,
Go ahead.
so I'm in India right now, past midnight. So I am a Fulbright-Nehru Distinguished Chair, and we are completing a 6-month, started about 6 years ago, a trial of a grassroots concept called Surgical Accredited and Trained Healthcare Initiative, which is really task shifting. So a lot of the effort is directed towards other conditions, but not surgical unmet needs. As you know, surgical unmet needs are huge problems. So we have finished the pilot, we created a curriculum, and these people, the healthcare workers, are 8th grade, and they live in the community, the dense slums. And these people, they are able to diagnose, and I just sent you a link of extremity injuries, kidney stones, cataracts, hernias, and menstrual disorders. So in our initial pilot study, we found that in Ahmedabad, which is a city of 6.5 million, the slums had these top 5 conditions. And we have taught these community health workers to be able to diagnose, take blood pressure, blood sugar, use basic ultrasound. And the most important is building trust with the community. So they have universal health care coverage, just like Obamacare. Prime Minister Modi introduced Modi Care, which is now 3 years old, but we found that over 50% of the users were not utilizing the services for these unmet surgical needs because of distrust in the community. So at the end of the pilot, we have found that we have been able to convert unmet to met need by about 60%. So these patients are able to get their cataracts done, improve the quality of life, get kidney stones done, especially women. They are able to get the menstrual disorders diagnosed. Some have got hysterectomies and so on. And now we are working with some of these big companies called Tata and social impact funds to see how we can extend it to the entire city of 6.5 million. I've sent a link in the chat box about the curriculum and so on. So all this has been piloted and tested. It took about 6 years with the support of the Fulbright and various other NGOs.
Fantastic work. It's part of the theme. I'm just looking at the article is, as you mentioned, you can take someone with an 8th grade education and upskill them to do blood pressure screenings or others, or there's examples in the United States, in certain communities, the barbershop model where African Americans get their blood pressure screened, but you can imagine all the other ways you could bring to a barbershop or any place outside of traditional care and enable anyone who's got some basic training to both collect the data and help make use of that.
So they collect the data, they treat the wounds as well, and they do this blood pressure, blood sugar, and diagnosis as well for the top 5 surgical conditions.
Any takeaways on how to leverage that, beyond India? Because there's a shortage of little doctors, nurses
everywhere.
Yeah.
So this pilot has been supported by the Indian Institute of Public Health, by the Fulbright, by the various NGOs. So we have published 4 publications, and now we are coming to the final one, for which I'll be here for a month more, is to show the data from unmet to met need, which is around 60%, which is quite good. So now we'll put it out, and then it's for others to, and the curriculum is also there in the, they can adapt it. And it's in multiple languages, the curriculum as well as the set of PowerPoints.
One thing that came to mind from that was India is a large country with a lot of disparities, but now you have a individual medical ID number, I believe. Maybe you can explain how that works.
Correct. So in Hindi, it's called Ayushman Bharat, which you can translate to Modi Care, and each one gets a card with the biometrics. So it is not, if you move from one part of the country to the other, you can still obtain the care. And there is no income. So you don't have to pay in certain amount, like to get Medicare or so on. But there is an upper limit on the procedure, the cost of the procedure. So this can be done in private hospitals, in public hospitals, and up to 500,000 rupees, which covers most of the surgical procedures, are free. So, but there are still certain gaps, like it doesn't cover prolonged dialysis. It covers kidney transplant, but not dialysis. It covers cancer care, but probably not bone marrow transplant and so on. So it's a question of fine tuning, and the big Karolinska Institute from Sweden, their whole team is here right now. They are trying to see how they can fine tune it. And their interest is how they can apply it to Africa, as you were saying. It's a worldwide problem. But India is a good laboratory to do all this stuff because it's English speaking, it's democratic, it's free, and the NGOs are very keen to get involved with this kind of work.
And the data from that will be certainly interesting. And also platforms like Starlink are opening up internet access to whether it's Ukraine or rural India to rural California. India's already pretty well networked. Are there predictions you have for 2023 or beyond on the ability for this sort of data to flow and be made useful?
I think well, they will have to create some sort of an app where we have written the publications and the curriculum and the PowerPoint. They can be accessed in different languages. So we have the data in English, Hindi, and Gujarati, 3 languages, but not in Swahili or Ukrainian and so on. So that is one possibility. The other is creating TikTok type, visuals so they can really see how to do wound care. Because right now, our entire team is there supporting the community health workers, but eventually they'll have to be on their own. Which dressing materials or ultrasound findings for kidney stones and so on. And something which cannot be measured is building trust, because these community health workers, not the limitations, but the entry point is that they have to live within the community. So they live in the dense slum in the city of 6.5 million. So they cannot be just coming from outside just because of the salary.
Right. Great. Well, lots of lessons to learn from there and beyond. Thanks. Let's move it over to Catalin, who had some ideas to share for potential XPRIZE. Catalin.
Hello, everyone. Thank you, Daniel. What I see in the world of venture capital, especially in early stages, and especially in those emerging venture capital funds, is a tremendous push in anything related to what you label as health span. What I expect will happen as a result of this in 2023 is that we're going to see an increase in the number of startups that are addressing this. And this increase will be massive compared to last year and the year before, and is driven by a number of things. It's driven by the fact that there will be a tremendous number of very technical people that are losing their jobs now. They are fully capable of following up on a dream, on the fact that they have, most of them, withdrawn money from stocks and other liquidities to try to avoid inflation, and now they're wondering what to do with it. And the fact that the pandemic put healthcare on top of mind for almost everyone. And a number, I see in Dubai, a growing number of established global VCs pursuing exactly this particular vertical. But if this happens, what I think will happen in 2023 is that we'll see a tremendous amount of uncoordinated effort with a lot of waste that comes from, let's say, those who are successful but uncoordinated, and there's a lot of duplication of effort trying to achieve similar things without talking to each other, without cooperating. And on the other hand, you have those who attempt and fail, but in failing, they still create something of valuable, but there's no mechanism to extract the value they created, and it's just going to be lost in a very large cemetery of failed attempts. So I was thinking, as a proposal for XPRIZE, if there would be a way to allow us to enable and incentivize a collaboration that would lift all boats in this particular early VC world, that would allow collaboration without really giving a competitive advantage to anyone. Now, I'm sure there are plenty of platforms that achieve portions of this, but what if there was one source of truth on this planet where you could go and just type, if you're Lee Stein, you type vagus nerve and you see immediately a map of what's related and who's working on it and what stage. If I don't know, if you're Stacy Chang, you're looking at all the opportunities to do the dual market approach, where you have expertise living in a high-tech country, but you enable and you serve the underserved populations with gatekeepers and key holders of sorts, and so on and so forth. So to summarize, because I'm taking too much time, a form of proposing a prime directive and a platform for coordinating what I expect will be a deluge of attempts. I don't have better words to say, but it just came to mind listening to you guys. Thank you so much.
Thank you. I think, how do you pronounce your name?
If you go for cat, I'll know what you mean.
Okay, thanks, Kat. And to your point, there already are a lot of merging solutions. A lot of them are point solutions. I think 2023 will be a year of a bit more consolidation. Some startups will fail, others will get potentially acquired. The main point is, no one wants 15 different apps or wearables or different UIs for their doctor or healthcare system. There'll be some convergence. And back to your point around health span, many folks are trying to enter that market. There's a lot of froth and hype and hope and snake oil, to be honest. And maybe to the point of your prize, maybe something we can do with Alliance and what we will hope to do with the NextMed health community is is help find these challenges that folks can cross collaborate on instead of competing, and all ships will rise faster. So stay in touch on that and maybe write out a prize concept and we can see how we can take that further. Others wants to jump in, quick shares, questions, feedback, ideas. This is all on the flow.
I just have a quick comment. With Lee doing the auscultation of the vagus nerve, we're actually doing that on the top of the carotid with the body tune. I know you've been speaking to Michael Freebe from Germany. And I just wonder, is it going to be imaging, or is it going to be auscultation, or is it going to be some other form of measurement of that electrical charge?
Maybe, thanks. Explain that sensor you're talking about for body.
The auscultation center, it basically listens to the carotid artery and predicts whether there's clot or not growing. And we found that it actually can predict from the leg or any other point, any of the arteries, on what the sound changes are over time to watch for any abruption or tracking post-diagnosis, if that's the case.
Thanks. It kind of brings to mind the fact that now even a simple microphone and all these new ways of measuring sound, yes, EKG, movement, all our digitome or phenome can be interpreted now with AI machine learning to some degree and give you pretty interesting insights, particularly when you crowdsource the information. It doesn't take decades. It could be done in weeks or months, right?
Yes. Yes. Interesting.
Fantastic. Thanks for sharing that out.
Mm-hmm.
Others have comments, questions, ideas, prognostications.
I think we should call on Kimberly. She's doing some cool stuff, this platform that she's written about with deep space biology. Speak up, say more.
Hey, Daniel, you're a friend of mine from during the pandemic from Clubhouse. I don't know. And if any of you spent time on the Clubhouse platform, but we built the Small Steps and Giant Leaps Club together with Alder Riley. And so I'm Kimberly. I'm the Executive Vice President for Deep Space Biology. We are a Georgia Tech CreateX company. We also we're one of the 6 winners of the Karen Space Prize, Karen Space Challenge, over 300 applicants worldwide. We just had our demo day in LA last week, super excited. We have built a platform called YOTA, YOTTA. YOTA is the largest measurable unit, and nothing has actually been measured in a YOTA byte. But we actually created our platform in a master's data analytics program at Georgia Tech and discovered that there's some major pain points in association to research and discoveries within the microgravity space, as well as the pharma space, academic. And, you know, there is this fragmented, disconnected knowledge that is, you know, throughout the world sitting there. If you can imagine, you know, NASA, all the billions of dollars worth of data and research and microgravity experiments that have just been really sitting there. And unless you have a triple PhD in biology, it's very hard to utilize. And so we, and just to share a little background, we had this crazy idea and did what any other people would do. We ambushed and sent a bunch of spam mail to NASA Gene Lab and just continued reaching out, wanting to, we had this idea, here's this information, knowledge just sitting there, billions of dollars have been invested in. And so we finally got an out of office response from one of the key people at NASA Gene Lab with a Zoom link to their AI for Life annual meeting. And so we showed up and we pitched our platform YOTA. And from that point on, we started working with NASA Gene Lab for about 2 years, unloading all of the GLDS research. And that's, so our platform, we essentially have kind of reverse engineered. We do believe that this platform is going to be deeply serving in the healthcare and medical and pharmaceutical space. But we've actually been able to make all of this data that's just sitting there come alive, and we have actually made it smarter with our machine learning algorithms. We're actually now serving on the board of the AI for Life committee, and we have started working with different scientists. There's an investigator from Mayo Clinic and I'll just share. Am I boring you guys?
Don't go too pitchy. Just give us your synthesis.
Yeah. I just want to share with you just kind of a case that, a use case. There was an investigator from Mayo Clinic who has been working on non-alcoholic fatty liver disease, which affects 25% of our population here in the United States. And there's no cure, there's no treatment. And it's also something that happens to astronauts and rodents in space. And because we have all of this scientific research on our platform, he actually came to us and said, "Hey, can you help me accelerate our research?" And so through that, we have actually found and discovered some hidden genomic sequencing that is now leading to advancing these discoveries. And so yeah, that's what we've been doing. And Daniel, it's nice to see you again, and would love to. I think AI, biotech in the space sector that is space for Earth is is important, and we have an opportunity to we're looking for partners and collaborators, and unlocking all of this information, but bringing it together.
Thanks. Can we put the resources or links in the chat so we know where to find those? And
yeah,
AI is plugging into everything. 2023 may not be the year of AI in healthcare, but it'll continue to advance. There's been many more FDA clearances for AI-based software as a medical device, particularly in imaging, of course, but that's going to play out to everything as voice as a biomarker for depression to things that could be leveraged in space and beyond. And of course, all the concerns about AI and will AI and robots take your job? We talked earlier about GPT-3 chat and DALL-E and what's the future of making art and music and content. So some interesting challenges there. In our last few minutes, I want to wrap in the next 5. Anyone with a quick 1 or 2 minute share, some idea about what they see coming in 2023 ish?
I'll go. Hi, everybody. My name is Afsana Naimola. I'm based in Silicon Valley, a former investment banker and a publisher of a healthcare IT news. Administrative costs, 20% of our healthcare spend. A couple of really promising companies are now putting analytics layers using NLP on top of EMR to adjudicate claims. So we may, in 5 years' time, starting in 2023, do away with claims.
So disruptive to the insurance world, but also the front office people in the clinic space.
Absolutely, absolutely. Blue Cross Blue Shield of California is working with Moxie Health on exactly that. I will pay you instantly as a provider if you give me a discount, and there is no claims generated. Very, very exciting. Very exciting. Use of NLP.
And can you give us a flavor of how much cost it is to the healthcare system today, all the time doing billing and reimbursement coding?
Between 16 and 20% of the 4 trillion. So including prior authorization. So NLP, which is really a form of AI, is going to be very pervasive to reduce the administrative costs.
Awesome. Fantastic insight. Thanks.
Very exciting.
And put a link in the chat if there's anything we should follow up on that. Any other quick shares?
I think we need to call on Robert Mason. He's doing some really cool thing as far as building the surgical metaverse. So he's got some really cool predictions about what's coming next. And he's just jumping in. So he has no idea what he just jumped into necessarily. So we're counting on the fact that he's nimble.
Well, I guess I have to thank you, Shauna, for throwing me into the fire. Now, real quick, you know, I'm a neurosurgeon. I've done micro neurosurgical, minimally invasive spine innovation for 20 years and a bunch of enabling tech. Real briefly, we are using AR and ultimately on the back end, artificial intelligence to basically superpower healthcare teams in the operating room specifically. We see the hands-free aspect of augmented mixed reality as a real opportunity not to always focus on the surgeon, which so many solutions are doing, but to focus on the scrub tech, the scrub nurses, the circulating team, and create an operating system, an ecosystem on the sterile field. You know, the sterile field is a sacred space, and it's really difficult to use digital enhancement in a variety of ways on the sterile field. Augmented reality brought that opportunity, so we're attacking it full force.
Fantastic. And that brings something we talked about earlier about crowdsourcing data, but there's this now emergence in digital surgery of maybe taking the learnings from thousands of, you know, advanced surgeons like yours, and maybe a more junior surgeon stuck in a battlefield or in an under-resourced environment can learn in real time.
Well, not only remote surgical performance and technique and procedural capabilities, but imagine the logistics. So there are hundreds of thousands of surgical tools in all the specialties. There are hundreds of equipment bases, anesthesia machines, tables, trays, fluoro units, microscopes, endoscopes, arthroscopes. All of these things have an orientation and logistical map. There's no system in place as we sit here for any of that logistics management. So we see AR as an opportunity to holographically use mixed reality to organize rooms, to organize, whether it's in your facility at your disposal or halfway around the world or in space, to your point earlier. It's all doable using digital tech, and then we can extend it to within the sterile field.
So I was just going to say, for those of us who were at XPRIZE at the scientific conclave, and one of the XPRIZE ideas was about autonomous surgery. This is some of the things that we were talking about, is that it's not one particular person or one particular phase. It is the entire surgical team and the suite, pre-op, in-op, post-op, the perioperative. So Daniel, I was going to say, I don't know if you wanted to, for those folks who, because we didn't do that in the initial overview. I don't think we mentioned the autonomous surgery.
Yeah, we mentioned one of the XPRIZes that's bubbling up is not just autonomous surgery, but the autonomous more surgical suite, everything from anesthesia to the scrub nurse and beyond, so that we'll get there.
Pharmaceutical management, consumable management, implant management, tool management, setup, organization, logistics, and ultimately the optimization feedback of AI to streamline procedures, streamline trays, streamline efficiencies, waste, you name it. Yeah.
And could you give us a taste of how that might democratize to the rest of the world from where you sit now? And given that there's a huge dearth, like several billion folks have access to no surgery right now.
Absolutely. And I'll use the test case of the pandemic. You know, when you look at it from a staffing standpoint, and particularly the teams, whether it be the nurses or the scrub technicians, you know, the pandemic really disrupted availability of resources to not only hospitals, but ambulatory surgery facilities. And then, you know, high financially relevant markets in the US absorbed key people. So peripheral, rural, and we can extrapolate this to a global economy. But starting with the US during the pandemic, if you had the most resources, you had the most staff. And if you had less resources, you had less access to staff. And so during the pandemic, there was an incredible redistribution of all the essential personnel that fundamentally have been underappreciated over the last 30 years of healthcare evolution. And you know, I'm a surgeon, so you know, I'm the problem. All the focus is on the surgeon when it comes to external views of the ecosystem of healthcare. But the critical third parties that are the rate limiting step to optimization of procedural efficiency and performance are really our team members. And the surgeons that are lucky enough to own the power to build teams don't have this problem, but that's the top 1%. The vast majority of ORs in the US, needless to say, the world, to the democratization standpoint, don't have the resource, the training, education, the know-how, don't have the capacity to go to a database that's internet-based that can look at doctors such and such in whatever specialty and say, how does he organize his room? How has he evolved to optimize the best test case for a surgical procedure, design, orientation, performance, execution, and waste? And then, waste, what does that equate to? More opportunity, more availability to third world countries of essential resources. So, it's all connected, but right now we have an incredibly fat infrastructure for surgical performance.
And I think building on that, this future of digitally enabled augmented surgery is platforms like Theater and others, like recording surgeries, learning from them, and will provide to the surgeon and the team, hey, slow down. This is the part you're about to make a mistake. Here's the learnings from millions of surgeries. This is the mistake not to make, and kind of go right or go left.
Yeah, well, we already do live Zoom-based surgeries for training internationally in spine surgery, but beyond that, we can record it, we can extrapolate from it, we can interpret it, we can autocorrect forward, and I can be in someone's OR halfway around the world using this tech. So,
but can you accredit them, like less trained surgeons? Like I'm a transplant surgeon, and we trained surgeons in Guyana, general surgeons, and we gave them certification so that they can give it to their, registration bodies or whatever.
correct. What's the question though? I'm sorry.
What I heard, in case there's a delay, was can you upskill any surgeon?
And can you certify them?
That goes more to the educational registration and regulations than the tech. I think the medium is capable of supervision, of on-field coaching, of onboarding a surgeon and evaluating competency and knowledge and execution. But there are still limitations to international, basically accreditation, if you will, of a given surgeon. I think in third world countries where American surgical support is already recognized as an established mechanism, yes, as a mechanism, it's incredibly viable to do over the shoulder, which could be, remote. But the fundamental accreditation process still has to be in place. So it's a little bit more complicated bureaucratically.
And Robert, I don't know if you remember, but just before the pandemic, we met in Utah, and you tried out my Marrow device.
Oh, that's right.
With the National Maradona program, which I love to bring back to you for your ortho procedure. So we'll follow up on that later.
No, thank you. That's right. No, it's good to see you again.
Worlds
I
collide.
did remember that. I didn't want to intrude on you on that, but thank you.
It was the idea, even as a medical person, not a surgeon, I helped the Stanford Biodesign program helped me catalyze thinking about better ways to harvest bone marrow, and Robert was kind enough to evaluate it a couple of years ago. So we're just about out of time, but I do want to do a quick round robin. Anyone wants to jump on anything that sparked, anything they want to share, pain points, solutions they want to evolve? I think we're going to go back to Tori, who had a follow-up as well. So quickly over to Tori Smith, and then anyone else wants to join in, and then we'll wrap.
Yeah, just curious if anyone's seeing the Virgo SVS artificial intelligence for GI imagery. It's really kind of uniting a lot of imagery coming from many different disparate sources. Made me think of that when I was listening to the previous speaker.
Can you describe that real quick? How does it work, and what does it do?
The founder is Matt Schwartz, and basically they just bring any imagery you're getting off of an endoscope into their system, and it in real time, it's doing some pretty cool data analytics and seeing lesions that you might not see, but then also bringing that into a larger database where you can do a lot with it. But it's just neat to see it uniting what was previously a lot of disparate imagery.
Right, back to maybe a theme of 2023 might be upskilling. I mean, you're getting your colonoscopy done, and some percentage of polyps are probably missed that aren't biopsy, but the AI sees it in real time and can suggest this looks like it has a reason to be accessed. Or back into the laparoscopic or surgical world, identifying a structure and giving guidance. So that whole blending of AI imagery, data sets, and upskilling, I think, will be part of this emergent future. All right. Well, last call for insights or predictions. All right.
I'll do it. Wait. before
Go
you
for it.
I think like what I'm hearing here, this is the thing I do at the end of every workshop. What I'm hearing you all say is that there's a way for, or what I think might be what you might be saying is that there's a way for technologies like GPT-3 to ameliorate some of the actual stressors within the system that are overburdening healthcare sort of globally, and that might reduce the trauma that is experienced by people at frontline medicine, like people who are dealing with patients first. I think that absolutely we're going to see an end to the billing process and the coding process as we know it, because also what everyone has, what everybody is beginning to understand is that the way that America dealt with the pandemic was phenomenally different than the way other countries dealt with it. And, patients are angry about that. I think that we're going to see, as was pointed out, an end to billing and coding the way that it is. When patient crying in exam is a code that can be billed for, you're going to see things like the end of coding and billing in that way, because there's just no way it can stand. Once people have found that out, once that secret is out, it's just not going to happen. I think that we're also going to see more things like chat and algorithmic services and that kind of that layer of artificial intelligence and that strength of artificial intelligence doing things like getting the complete narrative of a patient's experience and maybe putting it in order. Every time a patient meets with a doctor, they have to tell the story of their whole life for some reason. And you could have a very souped up digital twin, but without a narrative sense of order, of linear time, it's not the same. And so I think I think that we're going to start using, GPT-3, or chat type, frankly, women and people of color have been used in the medical profession. And so I think that it's going to do all the jobs that other people don't want to do, which is to say listening to patients. And so I think that getting their histories, getting their stories, getting their actual experiences, their embodied sensations, all of that is probably going to come forward in a big way, because the other thing that people have recognized, as Lee pointed out, is that, the body does keep the score. There are now more people educated about what trauma does to the body than there have ever been in history. And they can measure it because they're all wearing a device that lets them do that. And so I think you're going to start to see people who are like, wait, no, this is a real thing. These aren't just my emotions. These are things that have a quantifiable measurement that someone else is liable for.
Madeline, when you said that you don't think people want to hear their histories, what's been your experience where you have that sense that people who are practicing care don't want to? I will say that is the thing that I hear most from practitioners, is how frustrated that they are, that they're not able to spend the time in people's story.
Yeah, I think that that's accurate. I think that a lot of practitioners would love to have that information because it would contextualize things like symptoms. It would give context to like changed symptoms or things that have altered since the last time a patient was seen. But if the experience that I'm drawing from is both the experience of my mother when she was a cancer patient, and also the experience that my husband had when he had an emergency gallbladder surgery that then turned into sort of almost sepsis, and to biliary blockage and almost sepsis. And, he was a day away from blood poisoning. And we were very lucky. We live in Toronto, or the place that is currently known as Toronto, and we did not have to pay a dime for the care that he received when he was in hospital for 11 days. But the stress of every day telling the story to a nurse, or every day telling, like, this happened this week, then that happened, then this happened, then that, then these symptoms, then those symptoms, blah, blah, like, is exhausting. And what I think a lot of patients wish would carry forward is their history. And
Madeline,
so, yeah.
I'm sorry.
And
No,
I say that as a science fiction writer. I believe in the power of narrative and, and the power of linear storytelling. So
I think
I'm a bit biased.
it's incredibly compelling. And from I'm going to put on the spine surgeon hat, at the tip of the spear of modern spine surgery, it's minimally invasive, highly target acquired. And when you look at traditional diagnostics, it's the biggest opportunity in the dilemma of administering spine surgery. Where do you start? Where do you stop? What's the true target field? Most people are, oh, look at your MRI. You've got 4 levels of problem. We're going to do 4-level blah, blah, blah. The reality is that, to your point, the story is so critically necessary. It doesn't matter how beautiful the surgery is if you miss the target. And the target it's a clinical target. It's based on the correlation of whatever the imaging was, but most importantly, the story of the symptom pattern and the progression and the onset and the aggravating factors and the biomechanical loads and the relief patterns. And so a series of questions with an interrogatory with AI would help so much to at least give a head start and a cheat sheet towards a surgical target as one example. So I just wanted to chime in there.
Yeah, and I think Madeline, what you're talking about is it's not repeating it. It's what is that tool and technology that allows everybody to be in the same paragraph in that story, so that we're moving forward with it, but we also have the background and the context, so that when somebody's coming in, they already know all of that. But there's therapy in the story, and there's confidence and humanity as on the other side when you're delivering care, to know, I really know who you are. I know what you value. I know what you've been through. I know where your goals are. So combining those things, making sure that those technology, those tools help us to be more human, and not, they can remove some of the redundancy that exhaust us and frustrate us.
I think you're right, because I think that, certainly what everybody learns when they study trauma is that, recounting the narrative of what happened will bring the trauma back. You're re-traumatizing patients when they are asked to confirm again and again and again. Yes, I was assaulted. Yes, I was in this accident. Yes, this happened to me. Yes, yes, I was in combat. Yes, I lost a child. Whatever it is, again and again and again is only it's deepening the grooves in the brain that are feeling and transmitting those feelings through that vagus nerve, right? And so it's like, are we asking people to sort of, are we asking people for a pound of flesh every time they come through the door? And, on the one hand, sometimes we are through a copay, and other times we are through this.
Madeline, thanks for sharing. I love this insight, because now with some of these emergent things, whether it's GPT chat or another, you could write, please synthesize all my medical data, my labs, and my symptoms for the last 5 years and summarize it in 12 bullet points. And it can almost do that today and make that narrative evolving, and maybe is pinged by the AI that sees when something's off and you need to get visited virtually or physically, or for Dr. Mason, when a surgery post-op is going bad, he's not aware of it until a complication happens. Those subtle changes can be measured. And to the story also goes to how you communicate with the human, the patient, the consumer. We all get one-size-fits-all printout sheets, and you can imagine the discharge summaries are this emergent way that's in your age, culture, language. The UI becomes, with design thinking, telling the story back to you, how you might want to interpret whether your post-op care or your traumas from the past.
And it's really interesting, because we have the phrase trauma-informed care, but we don't actually have technologies that are supporting trauma-informed care. And this could be a really interesting adjunct to that.
I agree.
Cool. Thanks, Madeline. We got to connect more. I need to read your books. So we've had a great almost hour and a half. A lot going on. A lot will happen in 2023, and some things won't, but it's sure to be exciting, hopefully in more good ways than not. We certainly had our surprises in 2020, and things are never, what's that quote about, the only thing sure about the future is hard, no one can predict it, but we can start to try and shape it. So that's kind of the role of XPRIZE, particularly of the Pandemic and Health Alliance, is to start bringing folks together from different realms, like we've done here on this jam, to cross-fertilize and connect, find problems, solve for them, ideate, spark some ideas and solutions. That's what we'll be doing at NextMed Health in March with XPRIZE as a partner. So hopefully some of you can join for that. And with that, I will wish you all safe and happy holidays. Keep innovating. We'll be back in January for another jam. And you can stay involved through the links I shared, and always contact me directly as well. All right. Thanks, everybody.
Thanks, Daniel. So well done.
Thank
Have a
you.
great
Happy
one.
holidays.